Dr. Kristen here.
And Dr. Dalton as well.
And today we're going to talk about diaphragmatic breathing or belly breathing. So we talk about this with all of our patients because it's so important in regards to your activity and your core. So your core plays a big component with your low back and your spinal health and basically everything. So we like to go over it pretty much on visit 1 or 2. And so today we're going to show you with the Core 360 belt. So it's a belt that we use, and it has these, it has 4 areas. So 4 little ball areas that when we put around your waist, they help you cue areas to where you should be breathing into. So Dr. Dalton already has it on to kind of show you, but you want one of the balls kind of off to the side in the front and then as well as into the back.
So there's several components to diaphragmatic breathing that we like to look for. Typically we like to kind of instruct our patients as in there needs to be kind of 4 directions of movement once they take that breath in, and I kind of describe it as blowing up a balloon. So the 4 directions are typically through the belly button, out forward, which is easy. Everyone can almost do that one. Number 2 is out towards the side. So that's why we like to utilize these little dots, these little balls towards the side, because that gives the patient kind of some feedback onto where they need to be breathing in or feeling that pressure blow into. Area number 3 is typically through the back. So you're going to see we have it set up kind of right on the erector muscles, or kind of the back strap of the human. And then the 4th direction is straight down. It's straight through, it's caudal, straight through the pelvic floor. Now that's a little tougher to utilize, but that is the 4 directions. So we do like to utilize the balls on the lateral aspect as well as the posterior aspect, just because those 2 seem to be kind of difficult positions to work with. But
so typically when we think of breathing, I know you're probably thinking like, Kristen, I breathe all the time, but diaphragmatic breathing is a lot different. So if you've ever watched a baby breathe, they breathe perfect. So when you take a big deep breath in, your belly should actually expand outwards. And so a lot of times we have gotten lazy where when we're breathing, we are chest breathers. So you'll notice our chest going up and down when we're breathing. So we like to change the story for our patients because part of activating your core and getting your core nice and strong is diaphragmatic breathing. So if you think about your core, it's way more than just your core muscles that we all imagine. It actually involves our lower back as well, in kind of this whole area. So think of your core actually like a pop can. So when a pop can is sealed, that you can put tons of weight on that thing and it's not going to give or it's not going to break. So as soon as you open that pop can, what happens? So you let a little bit of air in and you create weakness. So same thing with the lower, or with the core. When we fill our abdomen and our core with air, our low back is now nice and stabilized, and when you're doing activities, it's not going to break or bend, and that leads to injury. So when I start with patients in telling them how to diaphragmatic breathe, I usually have them laying on their backs. So, and then what I instruct them to do is just first to see what they do. So I have them take a few breaths just to see how involved their chest is or if their stomach moves at all. Some people are inherently just good at this. If you do a lot of yoga or Pilates, those 2 areas definitely harp a lot on diaphragmatic breathing. So some people just are inherently have this already down, and some people it is actually an exercise that we give. So we make you go home and breathe. So what I usually have them start is I'll have them just put one hand on their stomach and one hand on their chest. So one hand on the stomach, one hand on the chest, and then I'm gonna have them take a few breaths. Good. So when we're going over this, I am cueing them, you know, this top hand should not be moving at all. We want all of the pressure from the stomach moving the bottom hand when they're taking a deep breath in. So when they take a deep breath in, their lower hand should actually be moving up and down with their stomach. So then once they get this down and they're getting a little bit better of kind of releasing that chest breath a little bit, then the exercise that I give them is I just have them think about their stomach or their abdomen as a clock. So your belly button would be 12 o'clock and your spine would be 6 o'clock. So then what I have them do is I have them use their hand and actually put pressure on their stomach. So when they breathe, they are pushing that hand off that area of their abdomen. So we'll start at 12 o'clock. So just your fingers on your belly button with a little bit of pressure. And then I'm gonna have them breathe and push that hand off their stomach. Good. And then once I get that down, then I just have them move their hands around the clock and eventually to where they're breathing into their lower back. So that's typically the hardest part, is when they start trying to push their fingers off the sides and anywhere in the back. So typically we can breathe pretty well just straight out, but that's not what diaphragmatic breathing is, because we want to activate that pelvic floor. So all right, so then we just have them go through each of those 5-minute increments around their stomach. And then once you get that down, like that's all you're doing is practicing 10 minutes of intentional breathing throughout the day. And I typically like to add in different positions. So you will get really good at diaphragmatic breathing on your back. But what I want you to do is I want you to challenge yourself, because we want this breathing to become second nature. So lay on your side, go into child's pose, do it standing, do it sitting, do it in any position you can think of so that it is truly going to become second nature for your body.